Good afternoon. Thank you for joining us today for our COVID-19 media briefing. It was a year ago this week, San Diego County had its first COVID-19 case. And this anniversary reminds us how long and difficult a year it has been. We, of course, recognize both the loss of life from the pandemic, more than 3,400 San Diegans who lost their life to COVID-19, and we recognize the loss of a way of life for so many. Our small businesses, our in-classroom learning, families, schools, and so much more. And I think as we look back over the preceding year, despite all of the difficulties and challenges and adversity that we faced, San Diegans can be proud of the way we've responded. We've saved lives, we kept our hospital systems intact and from being overloaded. And where we stand right now, a year later, is making substantive progress in climbing out of the COVID-19 pandemic. We are now at a point a year later where our daily actions are all designed to help us recover and help us move out. We're very mindful that we have to continue to monitor the spread of the virus. We're very mindful that we have to continue to utilize face coverings and avoid high-risk settings. We're very mindful of the possibility for additional strains. But we come before you today with a series of things that all represent progress and steps forward as we come out. Starting with our progress in achieving the red tier. This has been a lot of hard work of San Diegans in lowering the case count, a lot of hard work in getting vaccines into arms, but all of these have combined and come together to put us on the cusp of being able to achieve this next tier, which will be some relief for our gyms, our restaurants, and a series of other entities, but also represent another step in our progress. Our case count this week was about 8, and while that is above the number that is traditionally needed to descend into the red tier, there are 2 paths for us to achieve the red tier this time next week, which we think is highly likely. One is if the state hits the measure of 2 million vaccines in a certain HPI quartile of zip code, then that case count changes to 10. And we do expect that next week we will be under 10 as we are this week, which means as early as next Wednesday we are likely to descend into that red tier. The second one, even if the state doesn't hit that, we have another path to get there with the percentage of positive and health equity indexes, but we feel confident the state will get to that 2 million vaccines in the hardest hit zip codes, which will change the case rate for red and go to 10. We have 1 week now in the bank in red. We expect that we will be under 10 next week, which means there's a high probability and likelihood that next Wednesday we will descend into that tier. We obviously have to wait and see what our numbers are next Tuesday, but we feel confident that that will happen. Another positive step forward was the United States Congress taking action a few weeks ago to pass a $1.9 trillion COVID relief bill. This is going to help as folks get back to work, providing help to families who are in need, to our small businesses, to so many. We estimate at the County of San Diego it could be around $600 million that would come in that we could obviously use for the public health related expenses. We've incurred tremendous costs around vaccinations, continued costs around testing, and all of the efforts around public health response. But then we can also use some of those funds. The board will consider and decide how to use the balance of those funds, but to try and meet the need or fill in any gaps between state funding, federal funding, and where there still are needs. And so as we move forward, we will be assessing, the Board of Supervisors will, in terms of the prioritization of funding the public health related expenses to COVID, and then looking at how we can most effectively use what is left to try and help our region as we recover. We also saw good news with the CDC guidance this week for individuals that have been fully vaccinated, and this is also encouraging. There's certainly a lot of learning left to be done about the vaccine and the virus and what's happening, but based on CDC guidance, which the County of San Diego embraces, individuals can gather indoors, fully vaccinated individuals can gather indoors without wearing a mask, and you can, if you are fully vaccinated, gather indoors with unvaccinated people from one other household, as long as no one has an increased risk from COVID-19. So again, this is a continued progress for those who have been fully vaccinated to get a little bit more flexibility in daily life. We still want folks to avoid large crowds. Let's still ensure we're physically distancing from non-household members and all of the normal type things we do. But we do think, again, this is progress. If you remember in the early days, or not early days, throughout the duration of last year, there was great concern around the availability of enough hospital beds. And we as a county, in partnership with the state and federal and with our healthcare system partners, expended considerable energy trying to increase the availability of beds. One component of that was the Federal Medical Station, also referred to as the alternate care site that was stood up at Palomar. That was increased capacity and increased staffing that was available to be there. We are now in a position to have a kind of warm shutdown of that facility. The equipment and beds will remain in storage in San Diego County. The staff will be dispersed to other sites in the event they are needed, but there had been 0 COVID patients there, and so we're able to kind of wind down or stand down that capacity, which again is another positive step forward. Vaccines continue. The shortage of vaccines continues to be a challenge and a source of great frustration. We are encouraged. We continue to do significant numbers of vaccines and remain at the very top of the state of California in numbers done. Now almost 25% of San Diegans have received at least 1 dose and 1 shot. But there are shortages, and the bulk of what is being honored right now are second dose appointments. We honor those first, and then with what's left, we make first dose appointments available. Again, we've always thought the first half of March would be when we would see increased supplies. We're really hoping in the coming week that the numbers of vaccines that arrive into our county increase so we can reach more folks. We did receive about 14,000 doses of the J&J vaccine. Those were initially prioritized for those hardest to reach, our farm workers, our unsheltered, seniors, and other locations like that. I visited the convention center with Mayor Gloria to help administer that to some of those individuals. And then with what is left, they will go into the general circulation and supply for vaccines. So we will keep you posted on that. Speaking of the convention center, as the sheltering operation there for the homeless begins to wind down and those individuals are transitioned out of there, we are preparing to stand up an additional superstation location in the convention center. It will be pending the arrival of a significant increase in vaccines. So we don't know exactly when that will be. But we are making arrangements and preparations to be able to administer those. We do think at some point here, it's got to happen soon, hopefully, the supply of vaccines will increase significantly, and we will be in a position of maximizing all of our capacity at our close to 30 sites throughout San Diego County. On the subject of vaccines, on Monday is the greatly anticipated expansion of vaccine eligibility. These are for individuals with underlying health conditions. Now, again, it is going to be subject, the appointments will be subject to the availability of the vaccine. So it could be very limited appointments available until we see an increased supply. But on Monday, March 15th, we will open up eligibility for those 16 to 64 years old with specific health conditions. Includes cancer, chronic kidney disease, chronic pulmonary disease, sickle cell, obesity, Down syndrome. There's a listing on our website of the conditions that are eligible and apply. And within the next 24 to 48 hours, we will also publish on the county website the documentation that someone will need to make, will need to have if they show up for an appointment with one of these conditions. We're going to try and make it as easy and seamless as possible. We know our healthcare system partners know these individuals who have these conditions, and they are likely to increase their efforts in proactively reaching out to folks if they have vaccine available. Again, if they have vaccine available, but our public sites will also be available to these individuals with pre-existing conditions as well. So in the next day or two, look for guidance on how that process will work, and we will roll that out next week. So again, a series of things that I think all represent progress in our continued climb out of COVID-19. Again, being very mindful that the virus remains here, and we want to continue to be cautious so that we continue on a positive trajectory with things representing forward momentum. With that, let's jump into our charts real quick. First, you will see here, again, total doses administered. We crossed the 1 million mark. We're at 1,128,915 administered. You see almost 14,000 there, pending documentation to be entered, and a fairly significant number of those that are scheduled coming up. But you can see almost 25% have received 1 dose. 13.7% of San Diegans are fully vaccinated. Now that we go into J&J, obviously those individuals, when they get the J&J shot, will only appear in that bottom number. They are fully vaccinated. And again, we're appreciative of the arrival of that vaccine as it helps us adding to the array of vaccines that are here. We just hope we get more of them and quick. Case rates, again, remain very, very stable. Very low numbers you'll see here on the next chart. Our percentage of positive continues generally trending down. That is encouraging. Our daily numbers in the 300 to 400s, a day with 100. Again, the testing numbers are down. This is not due to a lack of availability of testing. Any San Diegan who wants a test, we continue to have a robust network of testing sites available. There is just less demand from the public for tests, but we will continue to make them available. But generally encouraging numbers on case counts. And then finally, the state monitoring metrics. You'll see right there we're at 8.8 is our adjusted case rate, almost the same as the unadjusted case rate. The two boxes there, the 3.3 testing positivity percentage and health equity, both of those were in orange. And so even if we don't hit the trigger for higher case rates, if those don't change, we would have the ability to descend into the red tier next week. And I just want to point out that our case rate at 8.8, 8.9, it was almost at 100 when we started this year. That is the progress that we have made as a case rate that was almost at 100 has come down to 8.9, which is a great credit to a lot of the work that everyone out there is doing. So good progress. We are working our way out of this and are encouraged to continue our forward momentum.